All right, so I know some of you from my mindfulness class, I know some of you from my chair yoga class, but really who I am is owner of Wellness 360. So Wellness 360 is a new physical therapy clinic. We're right up on the Main Street in the Village. We're on right on Barrett, where Ridge and Barrett meet, where Sherwin-Williams paint store is. Everybody knows the iconic Sherwin-Williams, right? So we share the building with Sherwin-Williams. So my business partner and I, Lindsay Perez, we decided we are in our mid-40s and we want to treat people the way we want to treat people. We're tired of productivity numbers. We're tired of jumping through hoops with the insurance and the co-pays. We wanted to be able to offer long-term disease management, and we wanted to offer one-on-one treatments for our patients the way we wanted to do it. So that's why we opened Wellness 360. So Wellness 360, we do one-on-one physical therapy treatments, which means when you come to us, you're never co-treated. It is you, it is me, or one of our physical therapists only for your entire treatment. We also do group fitness classes for long-term disease management. So what that means is they're cash-based services for people that have an osteoporosis diagnosis or want to work on their balance. Hi, come on in, welcome, welcome. I'm just giving a little rundown. You guys know who I am. You've been here lots of times with me, so I will, if you guys need to move your chairs anywhere, please feel free to do so. I'll hand these out. Hi, welcome.
Thank you.
And you can just flip your chair around for you and your husband. Okay, so those long-term disease management group fitness classes, they are not one-on-one, they're small group classes. Actually, you'll be hearing some boxing next door. Those are our girls there teaching the Rocksteady boxing class. So we take diseases like Parkinson's, osteoporosis, balance and fall prevention. We have some stuff for MS. We have some stuff for post-stroke. We take those diagnoses and we develop group fitness classes to help you with long-term disease management. Has anyone ever had physical therapy before? Has anybody started to feel really, really good and then they're like, well, you're done, insurance isn't gonna cover you anymore? So that's where these classes are meant to kick in, is when the insurance says we're no longer gonna pay for you, then you can slide into one of our group fitness classes so that we can support you long term. Most of our group fitness classes, unless you have a really fancy insurance plan, is cheaper than your insurance copay. So we try to make it really affordable so that you can be with us long term throughout your process. We also do massage therapy. I almost forgot, that's my main thing. So I'm dual licensed. I'm a licensed massage therapist and I work as a physical therapist assistant, which somebody had asked what that is. Basically, the physical therapists who are next door do your evaluatory process of you have knee pain, here is why. And then we step in and we treat you. We're the ones that come up with the plan to treat the diagnoses and what the goals are for you. So we have lots of different plans to work to your needs. Some people are like, can we just leave physical therapy or insurance out of it? Because I just want Beth Parry, I want her massage, I don't want any of that other stuff. Yes, we have wellness sessions, we have cash-based sessions, we have massage therapy, so we have different options for each person. So I'm kind of proud of it. It's really evolving and I'm really proud of it because it's new, it's unique, and it's the way that people should be treated. Not like a productivity number, but like a human being with a diagnosis and concerns. So that's why we started doing these talks in the public. We want to talk about things that you want to hear about. And knee pain, from the show of this room, is something that's really popular. I'm assuming everybody that's sitting here at one point has had knee pain, right? At one point or another. So we're going to talk a little bit about the knee, how it's built. Talk a little bit about why we hurt. And then my favorite part is to talk about what you can do about it if you're hurting. So, and if anybody has any questions during the talk, please just jump in there. I like to answer questions as they come because you might bring up a point that somebody else has, and it might detour the conversation to what you guys are coming here for and not just what I have to say. All right, so let's go ahead and get started. Let's talk about the knee joint itself. The knee joint is what's called a hinge joint. There are no tests after today's talk, so you do not have to worry about knowing what type of joint it is. But basically, a hinge joint, hi.
There, we have another friend joining.
Come on in. We have a chair open right here. There's one right up front. You get to choose. The ones that come in late always have to sit up front, so here you go.
We are.
Come on
We're in
in.
the right place.
All right, so the knee joint is a hinge joint, and basically what that means is it bends, it extends, you can rotate on it, you know, if you're dancing or if you're playing a sport. Yeah, so the whole purpose of the knee is a stabilizer, it's a shock absorber. Are we good? Are we comfy? All right, so it's a shock absorber and it supports your lower extremities. Now, if you've taken any kind of class with me as far as balance, you know that the knee is a really important part of stabilizing you for balance. So it starts out with the ankle joint, it goes to the knee joint, it goes to the hip joint, and then it goes to your core. So it's the chain of command, and they all should be working in really nice rhythm so that you can maintain your balance and you can move through life. Unfortunately, the knee gets a lot of wear and tear. There's a lot of different components when it comes to the knee. You have two bones at the bottom called your tibia and fibia. You have your kneecap, and then you have this long bone here called your femur. All right, so again, no test here, just to understand the mechanics of what the knee joint is. So when all of these bones are lined up properly, you have a cushion called a meniscus and cartilage in the middle of the knee that's supposed to cushion and absorb the shock. But what happens when we're bony, or we have some kind of knee issue, or we walk with a limp? What happens when we spend most of our life with the mom hip, standing on one leg? What happens when you go to play pickleball and you go and you torque and you end up tearing a little bit of your cartilage or your meniscus? You end up with knee problems. You end up with wear and tear on the knee. So the way the knee is supposed to stack is right on top of each other. Then you've got a nice little piece of cartilage in the middle and everything's nice and cushioned. But when your knee joint sits off this way or this way, you start getting wear and tear on one side over the other. And with life, and with having fun, and with movement, you end up wearing and tearing way too much of one side of your meniscus or your cartilage, and you end up with bone on bone. Has anyone ever said, well, you have bone on bone, or you need a knee replacement? You know, nobody wants to hear those words, right? In my world, I can honestly say I don't know of too many people that have never had knee pain, because the knees are what carries us through life. So I say, I love when the patient comes in and says, well, my doctor told me I had arthritis. Guess what? Everybody has arthritis. Everyone has arthritis. And I find that everyone gets very concerned when they get that arthritis diagnosis. I'm here to tell you, if you have arthritis, it's probably just a good sign that you enjoyed your life. You played sports, you went for walks, you went on vacations, you went up and down stairs, you enjoyed your kids, you wear and tear. If you're going to wear and tear a joint, chances are the knee joint's going to be the first joint that you wear and tear. Why? Because we're on our feet all the time. So the good news is there's a lot of things that we can do to counterbalance the strain and the stress that goes on our knees. Now, if you're already bone on bone, or your doctor's already said you have arthritis, or you're looking to get a knee replacement, that's okay too, because good news is Sometimes these exercises that I'm going to give you today is enough to stabilize the knee, make the knee pain more bearable so that you can get a few more years before you have to have that knee replacement. And the doctors now in the pain management clinics have some great shots. They can inject different things into your knee that can be very helpful to cushion, reduce the inflammation. So there's a lot of things we can do to prolong the inevitable of finally having that knee replacement. So let's go through just your typical types of injuries. I'm going to refer to my sheet a couple times because I do have a tendency to wander with my conversation. You guys have been in my talks long enough to know I'm a wanderer, so I like to try to stay on task the best that I can. So a typical knee injury, arthritis. We just talked about that. Good old Arthur. He's visited all of us at one time or another. An actual injury, someone that's actually had a fall, someone that's actually been in a car accident, maybe it's something that was out of your control. That is definitely something that we see a lot with knee injuries. Inflammation. Has anyone ever had inflammation before? Yeah. If you eat the American lifestyle, the American diet in your lifestyle, chances are you've had inflammation of some kind, or maybe you don't even realize you have inflammation. But inflammation is a really big problem nowadays because of the type of diet that we eat, because of the types of things we do to our body, stress levels. So I'm going to pull this door around only because I hear the boxing starting and it's going to be really distracting. There we go. Now we can all hear each other. All right. So inflammation, like I said, lifestyle nowadays. One of the talks I just gave last month or the month before was on chronic pain and stress levels, because there is a huge correlation between stress and inflammation. Because what happens when we're stressed is our body releases cortisol. Has everybody heard of cortisol? It's just a natural hormone that's released in your body. Well, the hormone is supposed to combat inflammation. It's really good for that spurt of injury. The problem is when we're stressed all day long, the body doesn't stop releasing cortisol. And long-term releases of cortisol leads to chronic inflammation. So there's a big correlation between people that have chronic stress levels and chronic inflammation and chronic pain. Imbalanced issues. If you have had a diagnosis of being bow-legged or knee knocked, where your knees go in or out, that can wear and tear on your joint. Having imbalance like what I'm doing right now, standing on one leg, that can do it. Like I said before, the mom hip, we carry those little guys or grandkids all through life on that mom hip. That can do it. So if you don't know already, if you haven't been to one of my classes or one of my talks, I'm from West Virginia. So in West Virginia, everywhere is mountain-esque. So when you're walking, you're never walking straight. You're walking sideways. So if I take the same path all the time to get my exercise in, and you're walking sideways, that is a muscle imbalance. You end up with, more wear and tear on one side of the body than the other. Overuse. My weekend warriors, my pickleballers, my runners, my bikers, people that go all the time. That's my overusers. And then we have our inactivity. I tell people all the time, I would so much rather have pain because of overuse than inactivity. Because inactivity, our muscles start to dwindle. When you are inactive, your muscles stop working because they don't have to. So if you're someone that does a lot of sitting, if you're someone that even has a job that's a lot of sitting and the muscles aren't being used properly, then what happens is we end up with these weird muscle imbalances in our hip, and then the body will turn the muscles off that's not being used, tighten the muscles that are being used, and then you go to stand up. You guys can come in. Well, looky here, we got 2 more chairs just for you. Come on in, guys.
Sorry we're late.
That's okay. That's
The
okay.
internet security talk.
Oh, okay. Well, thanks for coming tonight. All right, so we talked a little bit about your typical knee injuries. Now, this is just across the board, your typical injuries. There are so many other things that can happen, but for sake of we're only here for 45 minutes to an hour, we're going to limit it down to those types of things. So I want to talk a little bit about overuse and underuse, inactivity and overactivity, because a lot of times people don't realize, and they come in with knee pain, and we do just a few sessions and treatments with them, and their knee pain is gone. They're concerned, the doctor says, well, there's some arthritis, come back in a few weeks and we'll re-talk some options. But a lot of time what happens is the muscles are pretty smart in our body. So if you're sitting for long durations of time, let me grab my chair so I can show you. So if you're sitting for long durations of time, and you think about the structure of the body. So what we have is we have hip flexors that are right here. When you're sitting, these are like, hey, we're really crammed in here. So what we're gonna do is we're gonna contract. So the hip flexors get really, really short. And then your hamstrings in the back get really, really short because my knee is bent. And that's what a hamstring does, is it bends the knee. So then I go to stand up, your quadriceps, which are right here, get really, really long because they cross over the knee joint. So when I sit, my quadriceps are really long, my hamstrings shorten, and my hip flexors shorten. So when I go to stand up, anybody ever go like this when they go to stand up? And you gotta walk a little bit to work it out? Yeah, it's because our hip flexors are like, what are you doing to me? We like to be contracted, we like to be tight. So by the time you finally stand up, all of a sudden your pelvis starts to tilt and you start to get what's called a lordotic spine. So this is just one of our long-term inactivity imbalances. So what do we do in life? You walk what? You walk forward, right? How often do you walk backwards? How often do you walk sideways? Probably not as much as you walk forward, right? So the muscles that push you forward in life get really strong. But what gets weak? The glutes, these muscles here in the side of our legs, because I don't know about you, but I haven't seen too many people walking down the hallway like this, right? No, you don't do it. It would look silly. Although I have to say, I do have a guy that comes in for treatment that runs backwards. Really and truly. Like, we're talking 10, 15 miles he runs backwards. And he does it because of, that's exactly what I said, was whatever floats your boat. I think it's amazing. I can't believe he hasn't injured himself, but because of that hamstring quadricep thing, he had a lot of pain. But he found if he ran backwards, he had no pain. So he's still got his running in, but he ran backwards. I wouldn't have believed it if I didn't treat him myself. So it's a true story. So what I find is you have all of this muscle tension here from that forward walking. And then you sit and you have all that hip flexor muscle tension here. Well, let me tell you, your kneecap is attached to this muscle right here. It's ingrained. That's why when you have a knee replacement, they can't replace your patella or your kneecap because it's in your muscle. So this kneecap gets really tight, so it starts to off track. It starts to track off to the side or track into the middle or track up too high. There is this wonderful little groove right between all of those muscles that's the patellar groove. It's meant for the kneecap. But when you get overly tight in some of these muscles, you get this chronic pulling of the kneecap off kilter in that patellar groove, and all of a sudden, anybody have a closet door that comes off the groove and you try to open and close and it gets caught and it gets stuck and it doesn't work? That's what happens with your kneecap. You go to take a step and it catches. Or you start to get knee pain out here, or you get knee pain on the inside, and then you get some inflammation, which then just makes you go, I don't know where the knee pain is. It's either inside, outside, and when you touch it, it hurts. because you end up with all this inflammation around the knee, and it's hard to move. It's hard to do anything because it hurts. So what our job is to find out where that imbalance is. Is it really tight IT band? Is it really tight quadriceps? Is it weakness of the glutes? Is it weakness of the hamstrings? Is it truly wear and tear? So that's where we come in, is running you through different tests to find out what we think it is. Now, because of my dual degree, I'm the girl that gets the, we don't know what to do with them, can you put your hands on them and see what you find? And I can't, they're my favorite patients, the mystery patients. The patients that the PTs work with over and over, and they can't figure it out. So because I've been doing massage therapy for over 20 years, and I have a lot of training in what's called myofascial release, I'm able to get in there and see where restrictions are in the tissue that other people might not be able to find. So a lot of times what I find is once we loosen up this IT band here, the knee pain goes away. Once we loosen up the hip flexors, the knee pain goes away because it's not pulling on that kneecap left and right and up and down, and it's able to track correctly. Once we get that tissue softened, we get you in and we do really good strengthening for the knee. So we get the glutes fired up, we get the hamstrings fired up, we do all of the exercises that need balanced around the legs, and then all of a sudden the knee pain's gone. So it didn't matter that you had that little bit of arthritis. That's part of your normal day-to-day life. It just so happened that you were rubbing your kneecap until it was inflamed. So these are the types of things that we see most of the time when it comes to knee pain, is just being imbalanced in your muscles. Some symptoms, some mild symptoms are popping and grinding. I can't bend my knee without my knee popping. Grinding. Sometimes when I go to bend down, it sounds like there's a ratchet inside of my knee. Can anyone relate to that? You go to bend down and all of a sudden you're like, what was that? Oh, that was just my knee. And being a massage therapist, I'm always like, that was me. That was me. That wasn't your spine, that was my knee. So discomfort with activity, swelling and stiffness, and a decreased range of motion. What that means is you can't bend the knee like you used to. You can't extend the knee like you used to. So when you have limited range of motion, what happens to your body? You start to hobble. You start to walk different. And then all of a sudden, you're like, now my hip is hurting. Why is my hip hurting? Well, it's because you've been walking funny on your leg. And when you're walking funny on your leg, all of a sudden, you get these other ailments. It's very rare for me to not have someone come in and say, well, it started off in my right ankle, but now my left knee hurts, and I don't know why. Well, that's because when your right ankle was hurting, you were walking funny, and now the other side is trying to compensate to balance you out. The body, the whole purpose in the body is to find balance. So the body's working overtime trying to correct the things that we're doing to it. So if you have one side that's off, the other side's going to be off too, to compensate for the other side. Anybody have any questions, comments, concerns before I move on? No? Okay, let's go. All right. So there are some severe symptoms. When you get heat and you get redness and it's painful to the touch, that's a red flag. You're going to want to seek medical attention. If you get a fever with joint pain, that's no go. You want to go seek medical attention. If you get weakness or instability, which means you go to take a step and you can't put any weight on that leg, these are all signs of something more severe. I've had a lady once that actually took a nap, and when she got out of her hammock, she couldn't walk. And what had happened is when she was napping in the hammock, the way the hammock was, her leg was hyperextended for the whole nap. So when she went to bend it, it tore her meniscus. I mean, I can see like a pickleball injury. I can see, but I was injured from napping. That was her thing. I got injured in my nap.
In my hammock.
Yeah, in my hammock. Yeah, probably along the lake somewhere because we're in beautiful Lake Ontario. I mean, all jokes aside, she was in a lot of pain, but we were able to laugh about it. But so there are more severe things that can happen, but what I'm saying is the kind that kind of catches when you're walking, or the kind of pain that only hurts when you get out of bed in the morning, or the kind that hurts only when you've been on your legs for a long time. I have some ladies that, my knees only hurt when I'm in the kitchen making Sunday sauce, after they've been there for hours at a time, so that to me shows there's a muscle imbalance. That to me shows there's some weaknesses in the legs that we just need to balance out. So if you see any of the symptoms, the severe symptoms, it's definitely something you're going to want to get imaging for, or something that your doctor's going to want to be aware of. There's a lot of things that we can do as physical therapists. We don't have MRIs in our office, so we can't tell if there's an instability. There's some tests that we can run, but if you can't put weight on your leg, then you need to seek something, professional as far as doctors. So there are some lifestyle modifications you can make to decrease your pain, and that is eating an anti-inflammatory diet. I am not a dietitian. I'm learning a lot because I'm using a dietitian. So I am learning a lot about that. I do know a little bit because I've taken some classes, but as far as the anti-inflammatory diet, that's definitely something you want to see a dietitian for. Weight loss goes hand in hand with that dietitian, right? Eating the anti-inflammatory diet. But any kind of extra weight that we have on our body, the knees are the shock absorber. So there's no way to cut the knees out of it. You walk, anything you do that's in the upright position, your knees are going to be a part of it. So they are carrying the weight of what we've put on our bodies. One of my favorite parts of those weight loss shows is when 8 weeks down the road, they have to carry the weight that they lost. So they have to carry it in sandbags. So, you don't realize how much an extra 5 pounds is until you have to carry it through life, on your arm. And then exercise. Believe it or not, exercise is the best thing you can possibly do for your knee pain. You want to be careful as to what types of exercises you're doing, but exercise is by far one of the best things you can do. Let me go back to arthritis. Anybody have joint pain when they first wake up in the morning, and then once you walk around for a little bit, it feels a little better? That's arthritis. So what happens when you're sleeping at night is you're sleeping, you're resting, but the joints aren't moving. And joints don't get a lot of blood flow. It's just the science behind joints. That's why a meniscus or cartilage does not recover. It doesn't heal, because there's no blood flow to go to the area to heal. So when you're lying still in bed at night and you go to take those first couple steps, it's because you're literally rusting. There's no fluid in the joint. It just doesn't feel good. It's like the Tin Man. You need a little oil in the joints, right? So as you step and as you move, what happens is the joints move, and it pushes on the cartilage where this what's called synovial fluid is produced. And the synovial fluid is the fluid that cushions the joints. But it doesn't cushion the joints if you're not moving them. So you have to move them in order for the joints to stimulate the production of the synovial fluid. So sometimes when you're having discomfort, the last thing in the world you want to do is go for that walk, or you want to, go play pickleball, or you want to go do something. Sometimes the best thing we can do is just to get up and move. And that's why in the morning when you first wake up, your joints are really achy, and then all of a sudden by the time you get your coffee or the time you take a nice hot shower, you feel better. It's because the joints just needed lubricated. So movement is by far one of the best things that you can do. So I have some exercises, and I want to explain these exercises a little bit to you. If you currently have knee pain, and I'm going to go with the assumption that all of our knee pain is coming from either arthritis or it's coming from muscle imbalances. So what we like to do and what we do in physical therapy is we find the joint that hurts. Then we want to strengthen the joints above it and the joints below it. So if you're coming to me with knee pain and you're like, it hurts so bad to bend my knee, The last thing I'm gonna do is have you do a bunch of squats, because it's just gonna aggravate your knee pain. So what we wanna do is we wanna keep the joint in a nice neutral position, and we wanna work the joint below, which would be the ankle, and the joint above, which would be the hip. And let me tell you, the glute work and the hip work is probably gonna be the one that helps the most. So the first exercise is a hip exercise. So normally I would have you hold on to a chair or a countertop, but because I'm demonstrating, I'm not gonna hold on. So what you do is you kick your leg nice and controlled out to the side and you bring it back. Now remember when I said we walk through life forward and these muscles get really strong and really tight? They're going to overpower all of these exercises. So what's gonna happen is you're gonna go out to the side and watch my toes. You're gonna end up like this. Why? Now it's my quad working and not my hip. So as you're doing this exercise, I want you to turn the toes forward and slightly in, and I want you to do, you're gonna be like, whoa, there is a significant difference. You can be, I can do this all day long. Well, yeah, because you're doing it incorrectly. Because your quad, who's already strong, is trying to do the exercise. So you're gonna turn your toe in and forward, and you're gonna go nice and slow, and all of a sudden you'll feel your glutes turn on. You'll be like, okay, so this is not as easy as I thought it was. So that's really important because we want to strengthen up these glutes that get so weak. Some bonus points, when you strengthen your glutes, it helps with back pain, it helps with posture, it helps with your breathing, it helps with all kinds of different things. So the glutes are really the key to knee pain. So, number one, you want to watch the toes. Make sure they're straight or slightly turned in, and you want to go out to the side. You don't want to fling it. That's just momentum. You want to control it. Nice and controlled. You want to feel the muscles turn on and off here. Then we're going to go to the joint below the knees. And we're just going to do some nice heel raises, toe raises, heel raises, toe raises, because we want to make sure the joints above and below the knee joint are stable, and they're stable by supporting the hips, which is above, supporting the ankle, which is below. The next couple exercises are also improving that glute strength. Now you don't have to get on the floor to do this, you can do it right in your bed. But if the very first picture is you stacked with one leg on top of each other. So knees are bent. Same thing is gonna happen here, is you're going to want to turn this quad on as you're doing it. So what I want you to do is put your hand on that hip and make sure it's the glutes and not the quad that's turning on when you do this side clam. Now, envision me on my side. I'm not going to get on the floor, but you get what I'm saying. You can lay on your bed. So make sure it's the glutes that are stimulated. A lot of time what people want to do is they want to overcompensate, and they're moving their upper body, and they're basically just rotating through. Body stays nice and stable. It's just the leg. And sometimes it's only an inch or two, because that's how weak our glutes are. It's just an inch or two that our leg lifts and comes down. But I would much rather see this than improper work, because you're just basically wasting your time. The bridge, I'm sure everyone has seen one of these bridges before. The bridge is when you're lying down on your bed and you bend your knees and you lift your bottom up off of the ground and you squeeze your glutes. This is really great for bed mobility, it's really great for glute strength, it's really great for knee pain, it's really great for back pain. You're gonna see this exercise a whole lot if you are in one of our PT sessions. This is really a great exercise that can go so far for so many different ailments. And then we have the straight leg raise, where we're strengthening. A lot of times when we're inactive and we're sitting, remember I said that tightness in that hip flexor? Tightness is not the same as strong. Just because it's tight doesn't mean it's strong. So what we're doing is we're gonna stretch out that muscle, but we also need to strengthen that muscle so it works properly and it's not just chronically tight. So stretching. So I will tell you, this first stretch I am not a fan of, but it's the only one I could find in the pictures that I had available. So, you know, just the normal holding onto the ankle, you know, you're holding onto the chair, stretching out the quad. I much prefer taking that leg behind you and then pushing your pelvis forward, because then you're gonna stretch that whole quad, you're gonna stretch that whole hip flexor, so you can bend into this exercise and just push the pelvis forward. You should be feeling a big stretch in that back leg. If you can get on the ground, the way to make this a little better is by kneeling and pushing your pelvis forward. If you can't get on the ground, this will suffice right here. Getting that nice straight leg here. It is really warm in here. Is anybody else warm? I'm hot. That's true though, that is true. Okay, so the next one is your IT band. Remember I said a lot of times you get what's called a lateral tracking of the knee. That's because this IT band comes down from the hip, it comes all the way down the side, and it connects into that kneecap area. Then it just chronically pulls that kneecap off to the side, so you're grinding all the time with that kneecap. So a way that you can do this in the seated position, and if you come to my yoga class, you'll see, is just crisscross here and just pull that knee just like this. So you can do it lying down on your bed if you're already there to do your bridges and your clams, or you can just sit there and just pull that knee across. So if you look at that picture, it's the same thing, it's just you're seated. All right, and you'll feel a big stretch here in the side of your leg. So that's very, very helpful. And last but not least, you're gonna stretch out your hamstring. So the back of the leg can get really chronically tight from sitting long durations of time. And this is where I see a lot of the knee pain coming from, is inactivity. Is people getting tight in the hip flexor, getting tight in the hamstrings, but they're not strong. So they're not supporting your knee as you walk. Your kneecap is just going all over the place or being overrun by these tight muscles. So you just kick your foot out, your heel goes to the ground. I say you hinge at your hips like a Barbie doll. Think about your old Barbie and Ken dolls where they don't move in their back or they don't move in their legs. They just move in their hips. So if you keep your spine long and you hinge forward, right now I'm feeling a huge stretch in the back of my leg. So you'll wanna just hold that long enough to get a nice release. So the big question is, how long do we stretch? It's really person to person. I've had people that say you gotta hold it for 20 seconds, and I've had people say you gotta hold it 30 seconds. I like to say hold it as long as you can, because the best thing you can do for a stretch is by holding in a particular position. So I'm not saying 5 minutes, but what I'm saying is just hang out here, and you'll notice as you take some nice deep breaths in and out, you'll slowly start to go a little bit further, take a nice couple deep breaths in and out, and you start to stretch a little further. But a minute and a half is plenty. You don't have to go any further than that. If you want to break it down into shorter spurts and you want to do 2 or 3 at 20 seconds, that's fine. As long as you're making a conscious effort and you're not just going, okay, 1, 2, 3, all right, we're moving on. We're good. We stretched today. That's not stretching. All right, and if anything, that ballistic can actually cause injury. So if you're gonna do it gentle until you feel a stretch, hold with deep breaths, and see if you, with your exhale, if you can move a little bit further into the stretch. If you wanna take a break, and then come back to it. All right, so as a kind of a recap, and then we can take some questions if you have an actual, like a personal question. The knee is a multifaceted joint. It does so much for our body as far as help us maintain balance. It absorbs all the shock of our body. It helps stabilize our walk. It's a really important joint. If you've lived life to its fullest, you're gonna have knee pain. It's just a part of life. When you can accept that, hey, this knee pain came because I was doing the thing that I love the most. I was chasing my grandkids, or I was climbing a mountain, or playing a game, or sleeping in a hammock by the water, You know, if you can just embrace it, that comes into the mindfulness aspect. Instead of resisting the pain and being angry at the pain, that's just stimulating a whole cycle of inflammation in your body. So just embrace the pain. Yes, it's here. I need to take care of it, but it's happened for a reason that I love. Maybe it's time that I slow down a little bit, you know, just temporarily, take a couple breaths, you know, whatever you have to do to play it in your mind. But don't resist it. The more you resist it, the more it's going to persist. So you just have to take control back of the knee pain. You have to do some exercises. You have to seek out physical therapy. You have to seek out something that's going to be beneficial so that you can take control back of that knee pain. So Wellness 360, we do, like I said before, everything is one-to-one. So you come in with us, it's your copay, whatever it is that your copay is. If your copay is really high and you want to do a cash-based services, we can talk about that also. A lot of times what people say is, I have knee pain, but I also can't afford to come weekly. We understand that. Sometimes you have $70, $80 copays. So it can be really, really, really expensive. So what we do is we set you up with an exercise plan. As long as you do the exercise plan, people seem to see results. And then in 2 or 3 weeks, they come back, they see us again, we revise, we review the exercises. This does not work for everybody. I have one patient that said, well, you gave me these exercises and I don't feel better. Well, how many times have you done them since I've seen you? Well, I haven't. We can laugh, but it's true. It happens to me all the time. So it depends on your personality type. If you are someone who's self-motivated and wants to see a change, we believe it's the consistency of you participating in what we give you is where you're going to see change. We are not a quick fix. Unfortunately, physical therapy is not a pill. You can't take it and mysteriously feel better overnight. It's something you have to work towards, but it's natural. It's something you can do on your own. They're exercises that can be easily done anywhere you're at. And the results are you feel better in your body, you feel better in your leg, you're able to do more, you're more functionally active. So, you know, it is the way to go long term. Now, if we don't see results in the first couple weeks and you're still in excruciating pain, then we know there's something more to the story. And we send you back to your doctor and say, it's not XYZ, it's something more. So we always want to make sure we're making an impact in making you feel better with each session. Unfortunately, sometimes in the very beginning, that's why we give it a couple weeks, it can get a little stinky before it gets better because now we're aggravating the knee that hurts. So it takes a little bit of time before things start to even out. It's like cleaning out your closet. It gets a little messy before it gets better, right? It does. You know, you can't clean a closet and have it continually look better. It's got to get really messy before it gets better. So, but you know, we can always evaluate the situation each time we see you to make sure that we're not pushing you too hard and that we're pushing you hard enough. Does anybody have any questions? Yes.
What about you need a doctor's referral?
So that depends on your insurance. Most people do not need a doctor's referral to see physical therapy. When you call to schedule an appointment, our front desk, a manager, will answer the phone, or Lindsay or myself will answer the phone. Once we take all your information, we'll call your insurance. Most of the time, you can get the first 10 visits or the first month covered with no doctor script. Then we contact your doctor, and if we can get them to sign off on the script, then you're good to go after that. Most of the time, we don't need a whole lot more time than that. You know, that'll give us enough time to see if what our evaluation of what we found is correct, and you should start to feel better. Most of the time when you're feeling better, the doctor has no problem signing off on the script. It's one of those scenarios that you come to us, let's say you were playing pickleball. I only say that because it's here in the Webster Rec Center. I don't play pickleball, but I have a lot of people that do. So you're playing pickleball, you heard it, you're like, oh, let me call Beth. You get in the same week, we do a couple tests, and then in 5 weeks, you're not feeling better. You're worse or in as much pain. Then we're like, okay, there may be a tear, there may be something more than we can see, then we would send you back to your doctor. Anybody else have? Yes?
Yeah, I
That's probably an imbalance problem. That's probably a strengthening problem. So there's a lot of things happening when you go from a sit to stand position. So what that would be is us trying to stretch out and strengthen all of the muscles in your legs so that when you do get up, the patella tracks in the right spot so that you don't get that grinding. So just listening to the symptoms and what I'm hearing is probably just a weakness problem.
So any of these would.
Yeah, they should all be very beneficial to you, yeah. And then of course, these are just generalized exercises. As always, if you have a particular thing that you're dealing with that these are not helping with, that's when you'd want to come in and say, all right, I really want something individualized so they can run you through some tests so we can really see what it is and strengthen what's weak and stretch what's tight. And everyone's going to be individual. There are some people that might have really tight IT bands, really strong hamstrings because they stand a lot or they walk hills. You know, all my West Virginia friends. And they might have really strong, but they're tight. So we gotta figure out a way to stretch out the hamstrings and strengthen the quads. So it just depends on what your test results are. Anybody else have any questions? Nobody? Is there any other topics of conversation? I think our next talk we're gonna be giving is shoulder pain, which is another biggie. Does anybody else have any other topics that they would like to discuss that I can write a talk for and let Daphne know? Anybody have any issues that they're wanting to hear more about?
Mine has bursitis in my upper arm.
Okay,
Doesn't hurt all the time. There's times when it stops hurting, and especially as I try not to lift too much.
yeah, so bursitis is an inflammatory thing. Yep, so the bursa sacs are in our bodies and they're supposed to be there to cushion. Unfortunately, depending on our posture, depending on what's going on, the rubbing can cause inflammation. Then it's very, very painful. So that would be a good, for the next talk, the shoulder talk, that would be a good question for Nicole. Yeah.
I thought maybe it was the shoulder, but it's just down here. Because I went to the orthopedic doctor and had the x-ray.
Yeah.
And it was worth it to tell me that it wasn't the shoulder.
It is nice. Yeah, it is nice. Well, I'm sure the shoulder does play a part in it because the bursa sac doesn't get inflamed if there isn't another player. There has to be another player. It's, you know, everybody wants to say, oh no, it's not your neck, it's your shoulder. They're connected. It's always both. Yes, it always is both. So, you know, it's just the way our world is going, which is another reason why Lindsay and I decided to venture off to Wellness 360, because we're all connected. You can have migraines from your SI joint. It's all connected. So I don't want someone telling me, well, you can't treat someone's SI joint because we're working on their head. It's a spine. They're connected, yeah. So chances are there's more than one element to your knee pain. It could be the way you're walking. It could be a muscle imbalance. It could be hip problems. It could be a spine issue.
It could be from the back.
I was just gonna say, it could be from the back. You were one step ahead of me.
That's what my doctor says. The knee pain could be from the back.
It very well could be.
Arthritis in the back.
Yes.
Yeah.
So the one thing about arthritis in the back, that's 100% correct and 100% true. But if we can stabilize the core and give you exercises to stabilize the spine, then the trickle down effect would mean the nerve isn't being pinched and your knee feels better. So that's another great point. So that's where PT comes in, is to find the source of why your knee is hurting and then treat the source. All right?
The comment is, I just saw a knee doctor. I guess he's a doctor. But anyways, you explained more about functions than any doctor I've ever dealt with over the years. I hear all these different things.
Well, thank you for saying that.
They don't explain.
It is my job, and this is my, if you haven't noticed, it's kind of my passion. I love, love, love to do these kind of things. It is not fake, it is real. I volunteered to do this, you know? It's because if you guys have more education and you guys understand why the knee hurts, what the mechanics are of the knee, it might might be something, I have had people come to me for so long for SI joint dysfunction. That's kind of my hot spot. I love SI joint dysfunction. And he was sitting on his wallet. That's all it was. He was sitting on his wallet, so all the time he's in the car, he's sitting like this, trying to correct himself, and every time I'm like, okay, something's going on, and I would go, I get these weird, like for women, do you wear a purse on the side? Like, all of a sudden I get these, like, I'm working on you, and I'm like, are you carrying your grandchild here? Like, I get these weird things, and sometimes it's been, the TV is slightly off to the right. Well, you're having neck pain because you're sitting like this for 2 and 3 hours a night. Or you're sitting on your wallet. So the more I can educate you, the more power you have for your own health and wellness. The more power you have, you're gonna make better decisions for your health and wellness. You know, it's no longer about, well, my PT said this, well, my doctor said that, well, I have to get a shot because blah, blah, blah. You get to choose. You don't have to go to the PT place your doctor sends you to. You get that choice. But sometimes going into the office, and I'm guilty, I'm preaching to the choir, I get it. You know, you go in, the doctor's like, oh, well, I really want you to see this particular person. I don't ask why. I go, oh, okay. And I go. You know, and we have a lot of patients. We seem to be the person that has tried other places and they can't get the results they need, so they end up in our lab. We're the island of misfits. So, and I love it, and I absolutely love it, because once you come to Wellness 360, you see the service you get is more than just.
How long have you been doing this?
We have been doing this, so we've been doing this for almost 20 years, but we've only had the business for 2. This is our 2nd year. Yeah, so we're not even there yet. March is our official 2nd year. Yes? What do you do for your feet? We can do all kinds. It depends on what the diagnosis is with the feet. There's a million different things. Yeah, so there's different exercises. Remember, the best thing for arthritis is movement. Yeah, well, that could also be some neuropathy. There could be some, like, there's a lot of different things that could be. Could be strengthening, it could be a movement thing, it could be the way you're walking. You know, until we get in and see it firsthand, that would be something we'd have to evaluate. Yeah, there's definitely mechanics to walking. It's a lot of mechanics. I'm glad we don't have to sit down and think about it every time we take a step. Thank God it's natural, but sometimes our natural is not the way it's supposed to be. All right, so I have some handouts up here, but our mobile physical therapy is just like our regular outpatient, but we come to you. We come to your home. So if you can't drive, or you have someone that can't drive and you need our services, we can actually come to your home and do treatment in your home. And then here's about us, and then a little one about our massage therapy. So I will hang out. If anybody has any other questions, I'd be happy to answer them to the best of my knowledge. If not, be looking for us again. Nicole is going to talk at our next series. She's going to be talking on shoulder pain. She's one of our PTs. I gotta say, we've worked hard, but we got some of the best PTs in the area, so they're pretty amazing. So you'll get to hear Nicole next time, and then if there is something, you have my email address, those that have this, or you have our website. If somebody would like to hear a particular talk or learn a little something that's in my scope of practice, I would be happy to write a talk and get on the roster to come back again.